Hey nurses, I'm Natasha, your care management nursepreneur. I'm a registered nurse care management consultant, and I help nurses and primary care practices understand and implement CMS aligned care management models that actually improve patient health outcomes. I want to talk about where chronic care management actually fits in healthcare. Chronic care management doesn't live in hospitals, it doesn't live in emergency rooms, it lives in primary care. And one of the biggest challenges in our current healthcare system is that we don't have enough registered nurses embedded in primary care to support patients between visits. So, I want to walk through how chronic care management fits into modern primary care and why it's essential if we're serious about improving outcomes for people living with chronic conditions. Primary care is where chronic illness actually lives. Most patients with chronic conditions are not sick enough to be hospitalized every day. They're living their lives at home, at work, in their communities. Primary care is where chronic conditions are diagnosed, medications are managed, care plans are created, preventive care is supposed to happen. But here's the gap: primary care visits are short, providers are overwhelmed, and most practices don't have the clinical capacity to follow patients closely between visits. That's where chronic care management fits. CCM is designed to support patients outside of the office visit, where most of life with chronic illness actually happens. The missing link in CCM: nurses in primary care. One of the biggest structural problems in healthcare is that registered nurses are heavily concentrated in acute care settings. We see patients once they're already in crisis, when their conditions are uncontrolled, when complications have developed, but we don't see enough nurses in primary care, where early intervention could prevent many of those hospitalizations. That means patients don't get consistent follow up, education happens too late, problems aren't addressed until they escalate. Chronic care management is one of the few models that intentionally brings nursing expertise into primary care without requiring patients to be hospitalized first. How chronic care management actually works in primary care. At a practical level, chronic care management fills the gap between visits. It allows nurses to check in with patients regularly, monitor symptoms and adherence, reinforce education, address barriers, early coordinate care across providers. This is not about replacing the provider, it's about extending the care team. Primary care providers set the medical direction. Nurses support the day to day management that makes those plans actually work. When CCM is implemented well, patients don't feel abandoned between appointments, they feel supported. Why this model fits modern primary care. Primary care today is under pressure from increasing patient complexity, more chronic conditions per patient, administrative burden, limited appointment time. Chronic care management helps primary care function the way it was always meant to: proactive instead of reactive, preventive instead of crisis driven, team based instead of physician only. And nurses are central to that shift. This is not new work for nurses. It's familiar work, finely structured and recognized. What happens when CCM is missing? Without chronic care management, patients disengage, conditions worsen quietly. Providers don't get timely updates, hospitalizations increase. Primary care ends up managing crises instead of health. CCM changes that by creating continuity and accountability between visits. Why nurses are essential here. This is where nurses belong, not just in hospitals, not only in acute care, but embedded in primary care, supporting patients over time. Chronic care management creates space for nurses to use their clinical judgment, build relationships, educate, and advocate, prevent deterioration instead of reacting to it. This is why CCM is not just a billing program, it's a care model. When chronic care management is done well, primary care becomes more sustainable for providers and safer for patients. In the next video, I'll talk about some of the biggest misconceptions nurses have about starting a care management business and what actually matters when you're thinking about this work. If this conversation resonates with you, I share more education like this inside my care management community, Empower Care Academy.